Good morning.
Good morning.
Sorry, I'm in the car.
All good. Good morning, Albert.
Good morning, Travis. How are you today?
Good. How you doing?
I'm all right.
Awesome. Morning, Rick.
Hey, good morning.
Everybody's piling on. I see.
Here we go. We're doing it in waves. Good morning, everyone. We'll give it a couple minutes and let a few more people join, and then we'll kick this thing off. Good morning, Dallas.
Morning, Travis. How are you, sir?
Good. How are you?
I'm doing fantastic.
Beautiful. All right, let's get this party started. Good morning, everyone. Happy Wednesday. Happy Hump Day. Today, we're going to have a demo of Rectangle Health. What they do is they have created a software gateway that connects to other medical and dental practices. And today we have Dallas from Rectangle Health that's going to be guiding you guys through the demo. To give you a little backstory on our relationship with Rectangle Health, we've been working with them for, I would say, about 8 months now. We've boarded quite a few accounts over that term. And we found a lot of success recently. And so now what we want to do is promote it and open it up to our sales teams in our ISO offices. So one of our, we can board these currently on TSYS. We can also board them on Elevon. Elevon's been putting a lot of efforts into their relationship with Rectangle Health as well. So it just shows, one of the largest banks, US Bank in the US, is investing a lot in Rectangle Health. So that shows, how great this solution is. But first I want to introduce Dallas, and I'll let him take it over and show you guys a demo.
Awesome. Thanks, Travis. And thanks for everyone for showing up. Hopefully I don't bore you to death in going through what we got going over here at Rectangle through Practice Management Bridge. So what I wanted to do real quick is just kind of set the stage for what a very high level demo is going to look like. So I just want to go through a couple quick slides, and then I want to show you the product and how it actually will passively integrate with pretty much any EMR out there. And I know the question, I know Kevin has asked the question a couple times, from a full-on integration as well, and what the difference is. So I'm going to talk a little bit about, hey, a front door integration versus a passive integration, how that works, and how we need to have that conversation based on what the client needs are. And then just really, again, show you guys at again, high level, because I know we have just a limited time, what it looks like and how it works. And then, really how we can win 100% of the time with the offering that we have. So with that, I'm going to share my screen just really quick and go through a couple items. So hopefully you should see Practice Management Bridge on your screen, hopefully. Okay, perfect. Okay, so real quick, what is Practice Management Bridge? What does it offer? And you know, how do we even open a conversation with a medical office? As Travis alluded to earlier, dental, any medical vertical that we're looking at, really primarily the ones, the one medical area that we have to be a little bit more prescriptive with, and how we have those conversations. Well, there's technically two. There's med spas, because med spas are a lot of retail and a lot of things, subscriptions, things like that. Doesn't mean we can't go and attack those, but we do want to have those conversations a little bit beforehand before we just go and board these accounts. And then pharmacies are a little different because they like to obviously manage their inventory from a prescription standpoint. There's always the CGIS certification, signing on the dotted line to get your consultation on the terminal. A lot of these pharmacies want that capability, and it's not something that we would offer through Practice Management Bridge. Now, that doesn't mean we can't have the conversation, because a lot of pharmacies don't want that. They just need an ability to process payments and get them uploaded to the EMR. That's the case, fantastic. That's exactly what we want to be able to do. So in thinking through that, as I go through this relatively quickly, just have that in your mind of, I can now go out and talk to any medical office that's out there today. And we can absolutely provide a path forward for them, whether they're on a standalone terminal system, or maybe they're already integrated today. That's fine. We can come in and make it better and get them, you know, basically unhinged from that integration and move forward with what we have within Practice Management Bridge. So what does that mean? There's kind of three buckets that we always want to talk about: pre-care, point of care, post-care. Our slogan and what we live by is a healthy practice makes healthy patients. So if the practice cannot run itself, then patients aren't going to be coming into the practice. So healthy practice, healthy patients. That starts at pre-care intake, patient intake, starts at point of care when it comes to actual payment intake, how that information gets sent over to the EMR system. And then post-care, what does their accounts receivable look like? What does their billing look like? What does their balance collection look like after patient has left the office? So all of those things, and you look over on the right-hand side where our key features, these are the basics. This is like your base version, basic, 2.0s of Practice Management Bridge. We digitize the entire payment process. We're going to automatically take every payment within Practice Management Bridge and post it over into their EMR system every single time. That way, we're saving time, we're speeding up the payment process, and we're making sure everything is accurate all the time, all the way through, soup to nuts, every single transaction that they do. And then down at the bottom, everyone has to be HIPAA compliant in this world, PCI compliant in this world. We make it easier from a PCI compliance standpoint because we're P2P encryption. So we have all that within the Lane 7000. And we make sure, whether they're in that pre-care, patient intake, whether it's submitting your forms, medical history, we can do that. We can set up cards stored on file to make payments before they even get to the office, maybe do a copay that way. Point of care, that's where the rubber meets the road from a payment standpoint. And then again, post-care. As we go through this, you'll start to see how the life cycle of the patient interaction with the office goes, and where we come into play and help so much. So, big thing to remember when we think about what our opportunity is and how we can passively integrate or fully integrate with every system. One big item to remember: it's got to be Windows based. As long as their system, their workstation, is a Windows device and not a Mac device, it's 100% go every time, which is good because 99.9% of all EMRs out there today are on a Windows device. Yes, you'll come across like a med spa that has MindBody, for instance. MindBody can work on both, but these med spas, they'll be out, and they want to have the Macs in their office to make it look all fancy, and that's what their ambiance wants to be. Well, let's just have the conversation. It doesn't mean we can't run our system on it. It's just the differences and functionality, they are there. So we just want to have that conversation. So for the sake of this group, I say just avoid Mac for right now, and let's just go attack everybody else that has Windows. As long as we have that, we're good to go. That's general rule of thumb. That you don't even have to ask, hey, Dallas, do we work with X system? As long as they're on Windows, yes, 100% of the time. So this pathway, what I was talking about before, pre-care, point of care, post-care, this is that life cycle of the patient interaction. We want to make sure there's as minimal friction for that patient, no matter where they're at in the process, whether it's pre-care and the patient intake, getting them scheduled, getting a reminder sent out to them, to point of care, running the card on file, doing the balance collect, all of those things. That and how we automate that through Practice Management Bridge, you're going to see that it has the same feel as if they were fully integrated, meaning they don't leave the EMR, because Practice Management Bridge just runs in the background and takes care of everything for them. And then post-care, again, if they have a third-party billing company, how can we, potentially replace that? Because we're going to digitize their invoices. We're going to digitize how their balance collect is sent out through text to pay or online payment portals. All of that is what gives us that ability to come in and hopefully offset a lot of their AR costs and a lot of their AR outstanding balances, speed that time up to get paid. That's the path to a healthy practice. I talk a lot about an EMR, so I just want to real quickly hit on this, and I'm going to show you guys the product. When we think about EMR, or some people would call it EHR, or some people call it a practice management software, all mean the same thing. It is the brains of the practice. So whenever we talk through, you go in there and you want to ask questions, one of the first questions that you want to ask is, an office manager or a doctor or the staff is, what's your system? What's your practice management system that you're using today? And you'll hear Dentrix, you'll hear EagleSoft if they're a dental practice, you'll hear eClinicalWorks if they're a surgery center or a larger association hospital, you'll hear Athena, you'll hear all kinds of different names and different brands of EMRs. That's great. That's what runs the practice. So whenever I talk about how we're going to work alongside that EMR, this is what I mean. This is how it's going to work. And you'll see here every aspect of their office and how the patient interaction goes is impacted by the EMR. Whether it's check-in, the receptionist is using that EMR to check them in, point of care, collecting payment, and then all the way down to doing your billing. So the who's who of the EMRs, right? So this is not an exhaustive list. Don't take a screenshot of this and be like, all right, these are the ones that we work with. And if it's not on this list, it doesn't work. Couldn't be further from the truth. These are the ones that are just like the name recognition that you're going to see out more often than any other. But remember, if they're Windows-based, you're not locked out. You can scale, we can work with whatever they have. A lot of offices, let's say they have multiple offices, they may not be running the same EMR. Like a dental office, for instance, 2 offices may be running, they have 4 locations. 2 offices may be running EagleSoft. The other 2 offices may be running Dentrix. If they are integrated, they won't have the ability to scale that and have all offices talk to one another. With Practice Management Bridge, we can do that. Doesn't matter what EMR that they're on. We can scale it, we can add locations, and we can make sure all locations see how other locations are doing. And I could even run a transaction at one location and post it to a different location. That's what gives us the ability to run Practice Management Bridge on multiple EMRs, even within one ownership group, which you're going to see a lot out in the market. So these are the ones you're going to see. These are the ones you'll ask, hey, does it run? Do you support this? Do we support that? As long as it's on Windows, absolutely 100% work with it. The list of passive integration, meaning Practice Management Bridge is running in the background. That's our number one path forward. The list of that is literally hundreds of different EMRs that we work with today. The path of that is the least resistance. From a full integration, where meaning Practice Management Bridge lives inside the EMR and the whole entire experience is there. That list is right now very, very short. So I wouldn't get concerned too much with a full integration and passive integration. Just run down passive integration and know that Practice Management Bridge will work 100% of the time if it's a Windows based. I know that there are some out there that want that Eaglesoft full integration. Fantastic. We have that. Let's go. Let's go get it. We can get that full integration and it'll work 100% of the time if they want everything to live within Eaglesoft. So it's just an easy conversation to have. It's a way to where we can, figure out exactly what kind of setup that they need. And then whether or not it's even possible from a full integration and passive integration. Passive integration, where Practice Management Bridge is running in the background and running alongside the EMR, your chances of success go way up because we have that capability across all EMRs. Full integration, that list gets very, very small. Okay. Now,
I have a question. Sorry.
yeah, go for it.
Have you guys ever worked with Boulevard?
Boulevard?
Yeah, it's like a office management software for med spas.
It sounds familiar. I'd have to look at our client portfolio to see if we have any currently on the books that are using it, but I can get back to you on that one. I personally haven't heard of it, but that doesn't mean we don't have clients on it.
Okay, thanks.
I also want to follow up on a question. So I have a client who uses Dolphin imaging. One thing that they express is they have to use their main processor. They use, I believe, NAB or some of that sort. Or because some of these places have partnerships with these specific processors, from what I'm understanding, we can still bypass that. Is that what this happens, or when they're stuck with them, they're kind of stuck with them?
Yeah, that's a great question, Rick, and I'm happy you brought that up. So Dolphin, Dentrix Ascend, you'll see it a lot with even eClinicalWorks. They have relationships with FIS. You'll hear this a lot. Hey, if you're using Dolphin, you've got to use X processor or vendor because they're their only one that will work. Couldn't be further from the truth. What will happen is you go in there and talk with them and say, and they're probably like, yeah, I don't really like having to do all these things that they're requiring me to, or stick with them because one, maybe the functionality is what they were looking for, or bottom line, maybe it's too expensive for what they're getting. That's great. We can come in and say Practice Management Bridge, absolutely, we'll work with Dolphin, and we'll turn it on, get it all installed. It'll navigate. They just simply all they have to do is turn off their integration. They'll call up Dolphin and say, we're doing payments outside of Dolphin now, and we just want to turn it off. They're like, okay, and they have no choice but to turn it off. So at no point is there ever a time where a proprietary, what they'll tell you is proprietary relationship, will lock us out. We will still be able to come in and provide the service that I've talked about, and I'm going to show you guys 100% of the time. Even if they say, well, you can only go through us, couldn't be further from the truth. They can go through technically whoever they want. They'll just say, hey, you're not a certified vendor or a certified API integration. That's fine. This isn't a certified API vendor integration type of situation. We're coming in alongside with our passive integration and just sending information to the EMR in a very easy process. That's why we're never locked out. Good question. Good question. Any other questions before I show you guys the quick ins and outs of PMB?
Hey, Dallas, quick question. If they are not going through their preferred vendor or who they are integrated with, are they charging something like how the Shopify charges a penalty of processing outside?
It could very well be. It could very well be. If they're not, then they might charge them an extra SaaS fee or a higher SaaS fee or a per item or per transaction fee because they're not using their integration, in an effort to try to get them to use their integration. At that point, I would certainly help them and talk them through why it is that they're doing that, and they may want to get a little bit more serious about moving EMRs if that's the case. Because I only heard, the only one that I've heard of that did that and have now stopped doing that was eClinicalWorks, because it just came back to bite them. So it's possible. I don't see it a ton in the market where we have those conversations, but in that case, the office manager comes back and says, here's what they're charging us if we don't use their integration. And they follow it immediately up with, so do you work with, and then they give me another EMR name because they're about to move. So that generally is how it goes if they're charging that for not using it. Okay, so I'm going to show you guys really quick. Everyone, do you see Practice Management Bridge, payments, and everything up on your screen? Okay, so this is the product. This is our software Practice Management Bridge. You keep hearing me say passive integration, whenever we get a practice signed up, this is what they're going to get. They're going to sign into it every day, and then in most cases, they're just going to minimize it. They're just going to minimize it, and they're going to run through their transactions and get everything going just as they were doing it before. Now, this other screen where it says eMedDent, this is our version of an EMR that we just developed for test purposes to show in a demo how this would work, how a payment process would work with whatever EMR that they're on. So in this case, let's say we're on Dentrix. I'm in a dental office and I'm given a demo of Practice Management Bridge, and they are using Dentrix. What I would tell them is say, eMedDent, just think of it as Dentrix for you guys for this demonstration purpose. They're not going to get eMedDent. eMedDent is not anywhere a part of Practice Management Bridge. It's simply for just demonstration purposes. And you'll hear that often whenever you guys schedule demos with our HPC. So basically what we tell them is you start everything in Dentrix because that's where your patient profile is. That is where your source of record is. We don't want to change that. So we start the payment process in Dentrix. We verify that the patient is pulled up within Dentrix. We have them swipe the card. They've got a Lane 7000 at their desk. So they tap, dip, whatever process they're going to do. And essentially, you'll notice that you get a screen pop up on the screen. All this is, again, happening within Dentrix. They won't have to enter the merchant ID because that'll be defaulted unless they have that multi-location experience that I was talking about before and they want to send a transaction to another location or maybe another doctor. We can do that. In this case, more often than not, this will be defaulted just with their merchant information. I'll type in the dollar amount which is owed, which is like confirm on Dentrix. And then from here, I won't go through all these details, but from here, it just gets more specific on all the detail we want to add in from a transactional standpoint into Practice Management Bridge. Patient ID, initials, last name, first name, any IDs that we want to add. Plus, down here at the bottom, if I click this plus symbol, I can add this card on file for future transactions and charge that card whenever I need to charge it. So if I'm going to set up if I'm going to an orthodontist to, drop a small fortune to put braces on my kid, then I can set up a payment plan at the office, capture the card on file, charge them every month, and everything gets put back into the EMR every month when that card is billed. That's what this Vault is. That's a secure card on file storage feature that we have within PMB. So I can do that all the time of card acceptance. Now,
Dallas, then does that store all of that patient ID and all that other information with that as well?
correct, yes. It stores it within their profile and Practice Management Bridge. And then what it will do is send the transaction data straight over to Dentrix and immediately update their file. So that's what I'm going to show you next. So yes, everything that you put in here in this dropdown and these dropdowns, which are all customizable. So maybe an office doesn't want to see all of these different options and have to fill them out. They just got to let us know, and then we'll take them all off, or we'll create new ones for them. So it can be very, very easy to say, I just need patient ID and I want date of birth. Okay, we'll put that in there instead. We can customize it by office as well.
So Dallas, forgive me. You're probably familiar with Zapier, correct?
Yes.
So is this pretty much like Zapier, but for the healthcare industry? I mean, just to keep it very simple for me, I'm a simple kind of person. Is it really just Zapier kind of thing? You just plug and play and it goes from one system to another system and it just uses that to overlap everything, and that's pretty much what it is?
Kind of, yeah, from a mindset standpoint, yeah, it's the same type of idea and how
just for this niche. Okay, that works for me. Then that makes my life a lot easier. Okay.
Yeah,
cool.
well, that's what I'm here for, make your life easier. So yeah, so the same thing in that industry. in the medical industry, and what we want to just open that vertical wide open to you guys to say, yes, we can help facilitate patient payments and automate the process, just as you know, you would do with other products out in other verticals. This is just medical specific. Okay, so what I would do here from this point, if I'm the front desk, I want to go ahead and complete the transaction. Click on submit. What's going to happen is it's going to pop up the receipt screen. It's going to tell me it's approved. Notice in the background what's happening. Just posting information into eMedDent, or in this case, we're using it as Dentrix. I sign on my screen on my terminal, and then click OK. And then it's going to give me the ability to send the receipt, right? So I can either print out a receipt or email the receipt to the patient, just as I would any other time. If I want to print the receipt out, it's a transaction receipt. So you'll get it. It'll have the office logo and all branded information up top. And here's your transaction information with the signature on there. So I can print it out and send it to them, or email, and they'll get the exact copy that you see here. And then I click close, and I just move on to the next transaction. So everything is automated. So just as though I was, you know, a lot of offices might say, well, you're not integrated because I have to go here and click that, and then go outside here and click that. Nope. I was in the EMR. I started the transaction in the EMR. I got my screen pop, type in the dollar amount, hit submit, and then it posted in there. And then I just move on to the next patient transaction. Do the exact same thing over and over and over again. So that's card in hand, card in-person transactions, paying at the counter. All of that is how this process works. Okay. Now, real quickly, I'm just going to high level these tabs on the left to kind of give you a high level of what they do. Vault, I talked about that already. That's just cards stored on file. Anytime we store a card on file, we can charge it by a click of a button. You know, obviously we're going to get approval from card holder when we do that, when we store that card for the very first time. That way, if we charge it 6 months from that moment, we have attained their written approval to store that card. That way they can't come back and say, wait a second, I didn't give you approval to charge my card. Actually, we have a signature right here that says that we did store your card and have the ability to charge it at any point for a bill that is due. So, and then they're gonna be, oh, that's right. So we have all that, we store that information within Practice Management Bridge. In the event that a patient forgets or whatever that we stored a card, we can show them, hey, where they signed at that point for approval.
I got a quick question. So
Yeah.
what if they're using a software right now that already have card on file?
Yeah, good question. So what we would do at that point is we would ask the question of how many cards are you storing on file? And then from there, we can do one of two things. We can either, whenever we use Practice Management Bridge, we move those cards manually over. Let's say it's like 50 patients that they're using card on file and they have them stored. We would manually just do a data transfer, have them type it in, create their recurring payment plans or whatever it might be, and manually do it. Let's say they have 500 on file. Then what we would do is we would do a token transfer, work with the previous processor to download the tokens onto our BridgePay gateway. That uploads the tokens. Then we take them and move them over into Practice Management Bridge to store those cards on file at that point, if they want to transfer them over at that from one service to another service within their current processor.
Also, I can help with that process. We've done quite a few complicated exports where you go through Visa's tokenization service, and some of them are very lengthy. We did one with Spreedly recently that took about 6 months. So, you know, sometimes it can be done in a couple weeks, sometimes it takes a couple months, but yeah, reach out to me and I can help with that process.
All right, thanks.
Perfect. Okay, so recurring payment plans, these are really will help you win in the orthodontics and anywhere else where you have large balance due, to where an office wants to give a patient an ability to set up a payment plan and pay off a balance over time. We have that ability to do that. Obviously, we're storing the card on file at that point, and then we set up the payment plan accordingly. Patient Express, I'm going to skip reports just real fast. Patient Express, this is where we can go in and actually send individual text messages to patients. 94% of the time when somebody receives a text message, they're going to interact with that text message within 3 minutes. Unless that person is a teenager, then who knows if they ever even read it, especially if it's coming from the parents, right? So that's not the case if it's teenager, but anybody else, if they're going to get that text message, they're going to interact with it. Why is that so important? Well, that's a heck of a lot better than sending them a statement in the mail to say, hey, you owe X amount from your dental appointment. That statement goes to them, snail mail. They're getting it 2 weeks after, 3 weeks after everything is adjudicated, and maybe they don't even open it. So now we're waiting 30, 60, 90 days to receive payment on a $35 balance due to that dental office. Send them a text message. They're going to open it within the first 3 minutes and interact with it. And we can monitor it. We can see when they opened it. We can see when they paid that text message or paid that balance, because they're going to have a payment link within the text message. All of that happens instantaneously, and it happens within Patient Express. Obviously, we need some patient detail, patient name and phone number to be able to contact the patient, but we can do that and provide that service for this office. I guarantee you, when you tell an office, we can empower your staff to digitize the payment process and get paid faster through text messages, through QR code scanning within the office, or if they want to put it on their invoice, they can do that. Or even within the office, we encourage offices to put QR codes in exam rooms and throughout the office, where patients can literally scan the code and make a payment. We want to empower that office to make payments across the board, regardless of capability, through that digital process. Text messaging is the best option. Up at the very top, balance collect, that's bulk texting. So if I wanted to have the ability to send 500 messages at one time to 500 different patients to tell them, hey, here's when your payment is due, and it's a specific to them and their dollar amount, I have that capability through bulk texting, through balance collect. I can do that now, and everything is automated back to the EMR when they make that payment. So this is just the tip of the iceberg when it comes to, and I want to be cognizant of everyone's time, but when it comes to Practice Management Bridge and where we start, it all starts in payments. It all starts with that ability from this platform of what this platform brings. You'll find as we talk more and hopefully more questions come, and I'd love an opportunity to come back and talk more about what the other offerings are within our platform, because you'll notice this little waffle right here where it says payments. We have the ability to have compliance and engagement added on to Bridge. What does that mean? Compliance, HIPAA compliance, does that mean OSHA compliance? Everything that an office needs, we have that ability to add. Engagement, exactly what it sounds like. Email reminders, text reminders, net promoter score valuations, all of those things are also within the platform. I didn't want to talk about them too much today because I didn't want to just turn on the fire hydrant of information, but payments is where it starts. And that's obviously where the rubber meets the road for everyone on this call, is go out there, open the door of opportunity within these medical practices to see where you would fit within the payment space. This is how you fit. This is how you win in those opportunities, and the ability to win 100% of the time, because there's really very few opportunities where we are not a good fit. As I mentioned before, we just have those conversations to make sure we're not a good fit in those pharmacy, type of situations where it's really complex, things like that, those med spas. Even then, I want to have that conversation before we say a full-on no. So I said a lot. I went over a couple minutes. I apologize for that, but any other questions from the group?
I had a question. Do you have any ability for dual pricing integration?
No, we do not have the ability for any type of dual pricing or surcharging. And the primary reason why is we went out and took a look at our portfolio and actually took, I think it was like about 500 different offices, and polled those offices and asked them, hey, would this be a feature that would help your office and be a patient satisfier? Because remember, healthy clinic, healthy patient. Overwhelmingly, these 500 offices that came back to us and said they would not want to have dual pricing in their office because patients have already started coming back to them and saying, yeah, don't do this because my other doctor tacked down their credit card processing fees, and I don't want you to do that. We got that quite a bit. That's reason one. Reason two is why we don't do it is because we see the value in what we're offering without that dual pricing, without that surcharging, to where these offices hopefully will, you know, if we do a good job in selling that to them and showing them that value, it won't stick with them to say, yeah, but I don't want to pay my card processing fees. I want to pass those on. So those are the reasons why we don't foresee any time where we're going to have dual pricing or surcharging capability within Bridge.
Understood. Thank you.
You bet. Good question.
The cost for your service, is it a flat fee? Is it based on, I mean, what's the price point? And then my follow-up question to that is, when I have a client that wants to do this, do we reach out to you? How does that process work? I mean, hey, I have a guy that wants to do it. Do I schedule an appointment to bring the doctor on or the office manager? And then you run your thing, and then at that point, then I just plug and play with our merchant services, or what does that process look like?
Yeah, really good question. And you know, Travis, I'm guessing we'll probably have to work through how we want to socialize a couple things with the entire group. One specifically, if it's a demo request, Coastal has a dedicated healthcare business consultant that does all the demos. So having access to that person's, her name's Valerie, having access to her calendar to be able to go in and book the demo with your client at that point, should they want the demo. Maybe they don't, and then we just we go past that, and we just go through and board the account. But should they want the demo, then we would do that. We would set that up. Valerie would conduct the demo, and then from there follow the normal process in boarding the account, just as it would be at any other account. You know, and I'll let Travis speak to that for you guys. And from a cost standpoint, it's all our cost is back to Coastal, so our cost is baked into card processing. So we just charge a BIP rate for the total volume that has been brought in by that specific account. And I believe it's 40 basis points is the cost, if I remember correctly, for what Bridge is bringing to the table. It's a 40 basis point cost on top of the transaction rate, essentially, at that point.
Yep, that is correct. And we have Frank McCready from our team. He's dedicated to software and integrations. So just reach out to Frank, and he will work with Valerie and get the demo set up. What we recommend, the best results we've seen, is to set up the demo with the customer. We've boarded quite a few accounts that didn't go through the demo. And what we're finding is once they go live, they're liking what they're seeing, and they want to know all that the software can do. So it's a little more time in the beginning, but we're under the impression, let's take the time, get them set up correctly, and you know, they'll be happier with the service. And then Ruth, I see you have a question.
Yeah, I do. And sorry if I missed this. Is there a bundle between, you can bundle treatment and payment approval, treatment type and payment approval, is that correct?
Are you talking, so like from a insurance standpoint, like getting
Yes.
the quote? And not right now. So whenever they come in, it's they're checking insurance like they normally do. And then they get that, hey, here's what's covered, here's what you need to pay. That's all going to happen still. It's not a service that we would provide through Bridge, but Bridge would then be used to make that payment of what is being approved by insurance at that point. We would help facilitate that payment. We just don't have that capability yet, but we are working on that through some other partnerships to have that as a feature within Bridge.
Okay, that sounds good. And then as far as the other two modules, the compliance and the engagement, those are a flat fee to the practice, correct? Monthly?
Those will be a little bit separate. We have the ability to sell those, but that's a little bit of a longer conversation that I'll have to have with Travis and team, is because it's sold separately. So what I mean by sold separately is sold by our team for that office, and then there's some benefits that come back, benefits that would have the ability to come back to Coastal at that point. So we're still kind of going through some of the the beta testing is how that's going to work from a partnership standpoint. So long way to answer your question. Yes, there will be a flat fee. It's a SaaS related fee for those other items, and it would be tacked on, but it would be sold by our direct team with some revenue share opportunities coming back to Coastal for those accounts, is how it would work.
Okay, so just to clarify, you can do text to pay, you can even do bulk text to pay, but as far as payment reminders, those would fall into the patient engagement module?
So payment reminders would be text to pay, right? So
Oh, okay,
now patient reminders, like, hey, you have an appointment coming up tomorrow, please
Scheduling,
confirm, schedule, all that would be engagement.
sorry, that's what I meant, more scheduling. Thank you.
You bet. Good questions, Ruth.
And also, I just posted Frank's email and direct cell phone number in the chat. So feel free to jot that down and reach out to him anytime. Any other questions for Dallas? Also, if you guys want, one of the things that's been working out is because there is that gateway fee of 40 basis points, we're doing quite a few savings analysis, or pricing analysis. Sometimes not saving, we're breaking even or paying more because of the value that this technology brings. So feel free to send those over to Vanessa from our team, and we can knock out an analysis for you guys. Any other questions? Awesome, let's wrap it up. Thank you again, Dallas. Appreciate you coming out and doing a demo of Rectangle Health. Like I said, we've been working with these guys for about 8 months now, probably a little bit longer. And we've signed up quite a few deals, and we're here to board more. Our focus as a company is we're focusing a lot on software and integrations, and they're one of our leading software and integrations, especially in this space. So yeah, if you guys have any questions, feel free to reach out to Vanessa, myself, Frank, and we're happy to help. Have a great day, and we're looking forward to talking to you guys soon. Take care.
Appreciate
Thanks,
it.
Travis.
Great.
Thanks, everyone.
Thank you.
Thanks, guys.
Thanks. Been great.
Oh, this will be recorded as well, so we'll post it in Iris.